So let's continue here and look at the various glands that are involved with the neuroendocrine system outside of the pituitary and the hypothalamus. So let's start with the pineal gland. The pineal gland will be responsible for the production of melatonin. Melatonin is going to be involved with regulation of circadian rhythms. For organisms that have heat, it's also going to be involved with regulation of reproductive function. So if we look at the pineal gland is going to be found at the posterior edge of the tectal plate, posterior to the thalamus, anterior to the occipital lobe, superior to the pons within the tectal plate. It's a small glandular tissue that is associated with the cerebral cortex. In there we have cells which we refer to as pinocytes. The pinocytes are the cells that will be responsible for the production of the actual melatonin that's being produced by the pineal gland that will go ahead and be released into the blood vessels contained within the gland itself. While the gland is contained within the cerebral cortex, it's connected by what's referred to as the neural stalk to the tectal plate. It is independent in terms of its overall function to the nervous system, which means that the melatonin that gets released has to go through circulation and will not function as a neurotransmitter. The next set of glands are a combined set of glands found in the anterior part of the trachea or the throat, just distal to the hyoid bone. And this is the thyroid and the parathyroid. So if we look at the thyroid is going to sit just inferior to the thyroid cartilage. It's where the quote-unquote Adam's apple would be for people. And the difference between male and female in this region has to do with the fat pad sitting over the top of the thyroid cartilage, as well as the robustness of the thyroid cartilage due to testosterone exposure. To the anterior side of the thyroid gland itself, we'll see a bilobular structure that is connected by what's referred to as the isthmus of the thyroid. Just above or just superior to the isthmus, we'll see the pyramid of the thyroid. The pyramid of the thyroid has soft connective tissue attachment to the underlying tracheal cartilages, as well as attachment to the thyroid cartilage. There are a host of blood vessels that will be coming from the carotid arteries that will go ahead and perfuse through the lobular region and the isthmus region of the thyroid, known as the superior and inferior thyroidal arteries. If it's to the right, it's referred to as the right. If it's into the superior lobe, it's the superior. If it's into the inferior lobe, it's the inferior. If we flip and look posteriorly within the thyroid, what we'll notice is that we'll notice at the very posterior inferior edge of the two lobes, the bilobular part of the gland, we have four little nodules. These nodules are referred to as the lobules of the parathyroid. There are four of them. They're referenced as the superior right, superior left, inferior left, based off of where they are located. If we go ahead and dive deeper into the glands, we'll get to the histological perspective of the thyroid and the parathyroid. The thyroid itself is made up of two distinct types of cells. One's referred to as the principal or the follicular cell. These are going to surround the colloid follicles that make up the mass of the thyroid gland. These are responsible for the production of the triido and tetraidothyronines, the T3 and T4 hormones that we reference as the thyroid hormones. Just outside of the follicular region, we have the parafollicular cells. The parafollicular cells are responsible for production of the calcitrol. So T3 and T4 are involved with regulation of aerobic metabolism and mitochondrial biogenesis. The parafollicular cells are involved with regulation of calcium levels within the blood. The old adage that we used to look at is that the follicular cells are going to be producing hormones that are going to regulate basal metabolic rate. But what we found out is that hormones coming from other tissues, in particular skeletal muscle, bone, and adipose tissue, produce hormones that actually regulate the production and release of TRH and TSH, and therefore we cannot dictate that it is actually T3 and T4 that are involved with controlling of basal metabolic rate anymore. The parathyroid gland is going to be made up of predominantly referred to as parathyroid cells. These parathyroid cells are normal endocrine secretory cells. They do not have follicles like we see within the thyroid gland. These are going to be producing parathyroid hormone, PTH, which acts as an antagonist to the parafollicular secretions as relates to calcium metabolism and calcium regulation within the plasma. It has been misconceived that these are involved with bone health and bone metabolism. They're only there in terms of bone health and bone metabolism as it relates to levels of calcium within the plasma. Calcium within the plasma is one of those regulators as in terms of clotting, and we do not want to have excessive amounts of calcium within the plasma. The next gland that we're going to look at is the adrenal gland. The adrenal gland is made up of two distinct types of tissue. We have the medullary tissue, which is predominantly nervous and is highly integrated into the autonomic nervous system in terms of its overall function. It's going to be producing predominantly monoamines, and the principal monoamine it will be producing are the epinephrine chemical coming from the chromaffin cells. The other tissue that we have there are endocrine tissues, and these endocrine tissues are going to be predominantly producing steroid hormones. The steroid hormones that are going to be produced here are going to be involved with either stress release, balancing of water and electrolytes, and have a small bit of androgenic and anabolic response. And we'll take a look at each one of these here. So here's the adrenal medulla. The adrenal medulla is going to be made up of a sinusoidal arrangement of excreting cells, which we refer to as the chromaffin cells. The chromaffin cells are going to be cells that are neurological in derivation. They are cuboidal and columnar secretory epithelial cells that could have developed into neurons except for the fact that they were sequestered within the adrenal gland during development. They're going to be producing monoamines, in particular the epinephrine monoamine, but they can also produce to a lesser extent some norepinephrine and some dopamine. Now, most of the epinephrine and most of the dopamine that we see in circulation during stress response don't actually come from the adrenal medulla. They come from excessive outflow from either the pituitary or from sympathetic neurons that are at target tissues, not necessarily within the adrenal medulla itself. Now, there are some epinephrine neurons that will synapse on the adrenal medulla, and their synapse actually is along the sinusoids, and we can actually get some norepinephrine released into the sinusoids as well. But once again, the predominant chemical that's being produced from chromaffins is epinephrine or adrenaline. Now, outside of the medulla to the outer or peripheral edge of the adrenal gland, we get the cortical region. The cortical region is made up of three distinct zones, which we refer to as zonas. We have to the most superficial, the zona glomerulosa. Zona glomerulosa is responsible for the production of aldosterone or mineral corticoids. These are steroid hormones that are released during periods of stress in an attempt to maintain normal hydration levels by eliminating the amount of fluid being lost at the kidneys. The middle zone, which is the largest of the zones, is zona fasciculata. Zona fasciculata is responsible for the production of the glucocorticoids. The most prominent of these is cortisol, or the active form cortisone. These hormones are released during periods of stress and are going to be involved with the regulation of fuels as well as controlling of inflammatory responses. The deepest of the layers, zona reticularis, is going to be producing most of what are referred to as the adrenal androgens, androstenedione and DHEA, or the functional DHEAS. The adrenal androgens can be metabolized into testosterone and is the predominant site of testosterone production for females and is the secondary site for testosterone production for males after the testes. All three of these zones are sensitive to increased levels of adrenocorticotropic hormone, ACTH, and when there is stress going on, all three zones will increase the rate at which the hormones are being produced so as to allow for homeostatic balance. So the entire adrenal gland is going to be responsive whenever we have any type of stress response. The next gland that we're going to look at is the pancreas. The pancreas has two distinct functions. Its predominant function is in digestion, where it's going to be producing a whole bunch of exocrine secretions for release through the ampulla of Vater in the sphincter of Oddi in order to allow for digestion of materials as it goes into the duodenum. The minority of cells are found within what we refer to as islet regions. The islet regions are indicated within the histology image. These islet regions are referred to as the islets of Langerhans. Some books refer to as the pancreatic islets. The islets of Langerhans are made up of 4 distinct types of cells. The most prominent of them are the alpha and the beta cells, followed by the delta cells, and then the F cells. The islets are responsible for predominantly production of hormones as it relates to glucose metabolism, as well as an anabolic response to feeding. That is the ability to take what we've eaten and put it into tissues and allow those tissues to grow so as to store the nutrients that have come in. These include the beta cells, which are going to be producing insulin, and the delta cells, which will be producing somatostatin. But then we also have other cells coming into play, such as the alpha cells, which will be producing glucagon, which is going to act as a counterbalance to the insulin being produced by the beta cells. It is the alpha and beta cells that people who have insulin-dependent diabetic conditions have issues with, predominantly the beta cells. But what happens is that with long-term diabetic conditioning, the alpha cells will also start to have issues with them. So now let's look at the gonads real fast. We'll get more into this when we get into the reproductive anatomy. So we're looking at the ovary here. The ovary is made up of 2 distinct regions. We have what's referred to as the ovarian cortical region, or the ovarian cortex. And then we have the ovarian medulla region. The ovarian medulla region is an area where we have large amounts of capillary and arterial interactions. It's also lined by a host of secretory cells. There are additional secretory cells found within the granulosal cells of the follicles. These secretory cells are going to be responsible for producing the predominant gonadохormones coming from females, which includes activin and inhibin. But then the more prominent ones that we most often think about, such as estrogen, and coming from the follicle itself, progesterone. These tissues are sensitive to follicle stimulating hormone, FSH, and luteinizing hormone, LH. The other gonadal tissue is the testes, as seen here. Within the testicles, we have two distinct types of cells. We have the germinal cells, which are going to be responsible for producing the sperm. And then we have the lytic and Sertoli cells, which are responsible for the production of gonadal secretions. The principal gonadal secretions coming from the testes would include activin and inhibin again, but also the predominant hormone we think about when it comes from the testes, which would be testosterone. So those are the glandular tissues that you'd be responsible for, but there's a whole host of other tissues that we refer to as the non-glandular tissues. These non-glandular tissues are actually as important, if not more important, in terms of overall homeostatic regulation than the tissues that we normally think about. And here is just a very, 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 very brief list of hormones that come from these non-glandular tissues that have great homeostatic regulatory functions for your bodies, which includes from the kidneys, erythropoietin or EPO, from the liver, hepatic growth factor or insulin and insulin-like growth factor, from the muscles, muscle ischemic factors, mechanic growth factors, irisin, and then a whole host of interleukins that can get produced from the muscles, which include IL-6 and IL-10. From the bones, we have mechanic growth factor, and we have a loading hormone that regulates feeding regulation based off of the need for the bones to stay loaded. We have from the adipocytes, we have leptin, we have adiponectin, we have adipocin. From the granulocytes, from the lymphocytes, from the macrophages, from the immune cells, we have things like TNFs. We have ILs, interleukins. We have serotonin. We have histamine. From the gastrointestinal tissues, we have things like ghrelin and gastrin. And once again, this is a non-exhaustive list. There are so many hormones, and we're finding new hormones every day coming from these various tissues, all having distinct and different types of regulatory functions where we have to rethink what tissues we actually think about when we think about what makes up the endocrine or the neuroendocrine system.